Welcome back to Rehab Now with consultant physiatrist Dr. Paula Dawson, our rehabilitation medical doctor. I am Alicia Taylor, your host. Welcome, Dr. Dawson.
Thank you, Alicia.
Remember to check our social media pages. On Instagram, we're Rehab Institute Caribbean, Dr. Paula Dawson and Alicia Taylor Music. On Facebook, it's Rehabilitation Institute of the Caribbean. Website, rehabcaribbean.com. Rehab Now is brought to you by the Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Denk, and Almighty Studios. Now, Dr. Dawson, this week we're talking about shoulder arthritis. You know how me feel about arthritis already.
Yes, I do. When I saw this topic, I was like, at least I'm not going to be happy.
I was so upset when I came and I was just like, oh God, this arthritis. But you know, we need to be edified. But more specifically, we're going to be talking about, let's see if I get this right, glenohumeral joint.
Mm-hmm. Nice.
And thank you. Thank you.
Nice pronunciation.
And the acromioclavicular joint.
Yes,
Did I get that right?
Acromioclavicular. And if that is just too much to roll off the tongue, you can say AC joint.
Yeah, people know it as the AC joint.
Not air conditioning or AC, man.
I cannot do this with you today, Doc. Not today. So where exactly do we start? I mean, a lot of people complain about having arthritis all over their body.
Yes.
I think I have arthritis. But
why do you say that though? Because you know the symptoms that we talk about when you're talking about arthritis are important to define arthritis. So if we're going to define arthritis, let's do that once and for all.
Great.
And set the platform.
Thank you very much.
All right. So arthritis is a medical condition of the joint, any joint, finger joint, ankle joint, knee joint, hip joint, and so each joint, as you know, the joint is where the bones articulate.
That's it.
All right. And so when you have, it's almost like the hinge of a door. If you don't grease the hinge, you're going to hear.
So it's our fault why we get arthritis? Why we develop arthritis?
Well, you see, that's a good point. But let me first tell you the structure and then what happens when we don't do what we're supposed to do that may develop in arthritis. So the joint, because there's always movement in the joint, you have to have some cushioning. And the cushion is from the
cartilage. Sorry, go ahead.
It's from the cartilage. And then now what the cartilage does, it creates like a buffer between the bones. What happens in arthritis, the cartilage is worn down. When it's worn down, you get bone on bone, and that is painful. But that's not the only thing that happens. Around the joint, you'll get thickening of the bone itself. They're called sclerosis. Oh. Yes, you get some little bony cysts, some little tiny outpocketing in the bone. You get bone spurs, they call them osteophytes, and you get joint space narrowing. And then what will happen is the muscles around the joint will also get a little bit weaker, you know. And so when that happens, one, you get stiffness, which you probably have one of the symptoms. You get pain, of course.
Definitely the pain.
You get decrease in function. God. And you can get swelling in the area.
Yes.
Right. And so those are some of the common features. You know, you're stiff when you sit down for too long and you get up to move, you're kind of stiff. Right? With arthritis, in the early setting of arthritis, you know, when you go to move for the first time, you get some stiffness, and then when you kind of warm up, you kind of get a little bit loose. But during the time that you get arthritis after a while, movement becomes painful because if you have no cartilage, you're now grinding bone on bone.
Jesus,
that's not nice, not true.
It's painful.
It is painful. So now you tell me why you think you have arthritis.
All of the above. Okay, let me reel it in a little bit. But yes. I think mostly it's the pain.
Yes.
As I'm feeling. You know them, tell me if this is correct. Because I used to hear my grandmother say it. Especially when it rains, that's when you feel the most pain with arthritis. Is that true? And why is that?
That is actually correct. You know, science can't exactly explain that. There is some changes in the atmospheric pressure when rain is coming, etc., when the weather is changing. But outside of that, though, you know, arthritis tends to do better in warmer when your knee or the joints are warm. And suppose, I guess when it's getting rainy, it gets a little cooler, you know. And they also say when they go in AC, when they go in the AC, the joint hurt them more, right? So it might just be because in Jamaica, what we attribute to rain is a cooler time, right?
That makes sense.
Yes.
Sorry, but before we go to the shoulder,
which is what we're talking about
today. That's what we're talking about. Shoulder arthritis. There's also this myth that only older folks get arthritis?
I love the fact that you brought that up.
Yeah,
You know why? Because arthritis is a degenerative condition of the joint, and so degenerative changes can occur through aging, which is old people.
Okay.
It can occur through trauma. So if you had injury to the area years gone by, it might change how the alignment of the shoulder. It could be abnormal posture. It could be, especially as it relates to the weight-bearing joints like the knee and the hip. It could be weight, overweight.
Yes. Okay, weight.
It could be bad biomechanics. Like a lot of people that they have, like not knee, this is genu valgus or bow leg genu varus. They are predisposed to having degenerative changes. Why? Because the biomechanics through the joint is not efficient.
I can't believe this.
You can't believe
So me I suffer because I'm not knee.
But the good thing is you can prevent that with muscle strengthening.
Okay.
And that's the wonderful thing about rehabilitation and doing therapy at the
Rehabilitation Institute of the Caribbean.
That's right. We can always help you with whatever it is that you're going through, right? And so you have to, these are some of the causes or predisposing factors that can give you arthritis. Degenerative change. So you have osteoarthritis, which is degenerative. You have rheumatoid arthritis, which we're going to talk about at another time, not today, because that's more inflammatory. It's kind of where the body makes antibodies against its own, like the lining of the joint. That's really what rheumatoid arthritis is. It's an immunological problem, right? And so you can have, outside of trauma, you can have some other arthritis, for example, copper, some abnormal metabolism in the body. You can have copper being deposited. You can have gout, which are crystals. Gout crystals can be deposited. Right. And so there are different changes, but today we're talking about osteoarthritis. As it relates to something like the shoulder, which isn't really a weight-bearing joint, it is a joint that you do a lot of movement.
Yes.
And so...
And stretch for your body.
And stretch. We're going to talk about rotator cuff.
We should.
Because one of the main causes of rotator cuff injury in women is when they're stretching back in the car to get their bags.
That is me every single time.
Yeah, you're going to hurt your shoulder.
And I keep hearing your voice in my head.
Yes.
Me stretching for the same way.
No, you shouldn't do that.
Man, that's bad.
No, you don't want to do that. Right. And so, for example, what could cause shoulder arthritis? Glad you asked. Did you ask? All right, let me make you ask. Go ask.
But what could cause shoulder arthritis?
All right, I'm so glad you asked. That's a very good question.
Thank you, Dad.
All right, so for example, shoulder arthritis, I'll start from the simple. Bad posture. You always sleep on your shoulder? On one side of your shoulder, or some people when they drive. I've had a taxi driver who he's always leaning on his middle console, and then now his shoulder become like a weight bearing area, and after a while that kind of mechanical pressure causes degenerative changes in the shoulder joint. In addition to that, people who use their shoulder a lot for occupations, for example, a painter when you're painting a house.
Really? Just something as simple as that?
Yeah, man. A carpenter, repetitive movement. Repetitive movement. Can cause, those are some of the
I thought it was people that move. What is it? I'm terrible at sports.
You mean the artist?
Yes.
Artist not different from painter.
No, man.
Painter paint the house.
The athletes. The one who throws the disc. What is
you have a throwing. You have a few throwing sports. Julian Robinson, not the politician. Big up Julian, family member. But anyways, Julian Robinson is one of our throwing coaches for Jamaica. And he's a very, very good coach. And so you have the discus.
Yes.
The one that's shaped flat.
That is the one I'm talking about.
Then you have the shot put.
God, is that the long stick?
No, that's a javelin.
I'm terrible at this.
The shot put is a big round ball and heavy like, yeah. You ever tried to lift it up yet?
I've never tried lifting.
Have you ever seen it?
Things like I've never seen it in real life.
Right.
Is it like really, really heavy?
For me, it is.
Okay.
But you know what? I big up, World Championships coming up in Oregon. Woo! All right. And so we're looking forward to our team doing well at World Championships. We have our field events, our field team. Jamaica is now having better field athletes, and we're looking forward to that.
That's amazing.
While we digress.
As usual.
From shoulder. So let's come back to the shoulder joint. So what is the shoulder joint?
I don't know. It's that thing that connects your arm.
Yes, the arm bone.
Yes.
To
the shoulder. I don't know.
to the shoulder blade.
To the shoulder. I was close.
So another name for the shoulder blade is the scapula. All right. And so right where the upper limb, which is your arm,
Okay.
is connected to the rest of the body through the glenohumeral joint. And that's a big joint. And then you have a little tiny joint, the acromioclavicular joint, the AC joint.
It's a big name for a small joint.
It is so small. Literally, if I put my 2 index fingers together and go like that, that's how small the joint is.
That's crazy.
And it's not even a joint that really should be moving per se. It gives you some mobility.
Well, me have longer fingers, so maybe my
Not the
AC
length
joint.
of the
I'm
joint.
Kidding, I'm kidding. I know.
So it's a really, you know what? If you were to feel your collarbone
Yes.
and go across to where you can't feel the collarbone anymore, that's the AC joint.
No, going across the
So you know your collarbone, right? And you feel go across.
Across.
And just before you get to the, if you're muscular like me, you might feel the deltoids.
I'm not muscular. I'm just
Right. So the acromion is a little curved, hooked bone which comes and attaches the shoulder blade to the clavicle. And so over time you get degeneration, you get movement, and you get changes in the joint space. You get decrease in the cartilage, right? And then you get a lot of pain. So my question to you now is,
Question to me. Let's hear it.
have you ever done any activity at home after which you have holy for shoulder pain?
Just all the time, doc. Just tell me if I wonder no if I have arthritis in my shoulder. God forbid.
Yes.
But yeah, so if I'm lifting things, heavy things, by the time I'm done, my shoulder is done.
Right. And then, okay, the reason the shoulder is, not really done still, because you still have it.
You know
The reason your shoulder gives trouble is, so there are four main muscles. Really, there's one more, which we call the rotator cuff muscles. We're going to talk about them in another episode, the rotator cuff syndrome.
Okay.
And these muscles, along with the long head of the biceps, a lot of people say the long head of the biceps participate in stabilizing the shoulder, which it does, but it's not considered one of the rotator cuff muscles. And so those muscles, they go over a little small area where the acromion is, and they tend to keep the arm on your body. Now, when you start having movement issues, those muscles may not fire as well as they should.
Okay.
And then you get a lot of pain in the shoulder.
Oh God, just the pain alone.
I know, I'm swelling.
It's too much. Okay,
Yes.
so we're gonna have to take a break, but when we come back, there's still so many things
Yes.
for us to talk about. Because we don't go into treatment, and we don't get into prevention.
That's right.
Because prevention is important.
Better than cure.
So better than cure. So stay with us. We'll be right back.
Yes.
Welcome back to Rehab. Now, if you're just joining us, we're talking about shoulder arthritis.
Yes.
As if it can't get any more painful than that.
I know.
And Doc, when we were on the break, you were telling me something about frozen shoulder. I'm
Yes.
very interested. I want to know what frozen shoulder is. What that mean?
And then when you go Antarctica,
Doc, me can't. No, man.
Okay. All right. So frozen shoulder, it's actually a clinical diagnosis. And frozen shoulder is when you have limitation in every range of motion of the shoulder. So the shoulder going forward, that's flexion. Backward is extension. Sideways is abduction. And inward is abduction. Adduction, sorry. So AB, AD, right? And so then you have internal and external rotation.
Okay.
Right. And so when you have a frozen shoulder, you're not able to do
all that.
any of those movements. So
Wow.
the shoulder
Are you able
is
to lift your arm, lift your hands?
severe pain. And so it's
gosh.
frozen in position, literally, because of pain. You may have some inflammation in the capsule, they call it capsulitis, like thickening in the capsule. And so you'll get severe pain. The interesting thing about frozen shoulder, it can be as a result of trauma. It can be, for example, you injured one of your rotator cuff muscle and you were kind of nursing it up, as Jamaican people saying. You don't use the shoulder. After a while, you get decreased movement, and then it can become so stiff that it becomes frozen. Then it can be after trauma. You may have fallen on your outstretched hand. You may have fractured a part of the humeral bone or fracture a bone around the scapula, around the shoulder, and then you don't use it, and then what will happen is now you become a frozen shoulder. But then there are some medical conditions that may predispose you to frozen shoulder, like thyroid issues, diabetic issues, yeah, man. And so the thing with frozen shoulders, I mean, when we come to treatment, we can inject normal saline with lidocaine, which is an anesthetic agent, to kind of expand the shoulder, to kind of loosen up the whatever it is that's causing the decreased motion. But the thing with frozen shoulder, it will run its course. No matter what you do, we can probably help with the comfort. But after a while, 6 months to a year, it resolves. Most times.
On its own?
Not necessarily on its own with the right treatment.
Oh,
but you can't necessarily speed up the recovery.
Oh, so it's not like a permanent thing.
No, it's not a permanent thing.
Oh, well, that's not bad then.
However, if you do nothing, remember, if you do nothing, nothing will happen. You get atrophy, and then your body, will want to stay in that way.
Okay, so we know that arthritis
yes
can be developed because of trauma.
Correct.
We know it's a degenerative
yes, ma'am.
Condition or thing.
Yes.
But what I want to know is, what if you don't exercise? You never have any trauma, you're not predisposed to anything, but you just your body is there, not exercising, not moving. Can you develop arthritis that way?
Yeah, man. So, for example, you have some people that like to, as I mentioned before, sleep on one shoulder. And you sleep on the shoulder for the whole of your life.
Yeah,
right.
I do that. I sleep on my left side.
Right. So sometimes side sleeping on that particular shoulder, as well as occupation, I told you, leaning on your arm all day long. Because your shoulder is not meant to weight bear. Your feet, your knees, and your hips are the weight-bearing joints, but not your shoulder.
So can that cause like referred pain?
In a sense, it can. However, because it's so localized, shoulder pain is usually felt in the shoulder most of the time with movement. You understand? With movement. Interestingly, I've had patients that have severe shoulder discomfort, and even when they're dropping a pothole, it hurts. But the good thing is, once you can. First, you have to make the diagnosis. So the patient comes in, right? And you say, what are your symptoms?
Yeah, okay. Yeah, tell me how you made the diagnosis.
Right. See, the patient comes in, what are your symptoms? Pain, one, in the shoulder. It usually doesn't refer, right?
Okay.
Rotator cuff, we're going to talk about that, can be referred. But shoulder joint pain is mostly on movement. Right? Movement of the shoulder. Because if you keep the shoulder like this, sometimes it may not hurt at all. But you can't live like this. This means her on the radio and said this. Them don't know what I do. Okay. So if you keep your elbow to your waist and you're just walking around with your shoulder, you don't want to do that. Some patients with shoulder arthritis, they do not want to move their arm at all. Right? And so they'll have pain with movement. They'll have swelling in the area. They'll have stiffness. Right?
Okay.
And one of the things, especially women, they'll tell you they are not able to button their bra because usually you have decreased internal rotation where you put your arm behind you.
Yes, we do that all the time, yes.
Right. Some people will tell you they can't comb their hair because they can't raise their hand up because the action of combing or brushing your teeth, reaching up in the kitchen to get something from the cupboard, that's another thing as well. And so they'll tell you it's usually symptomatic pain, decreased range of motion, swelling, discomfort when they're sleeping on the right side. Even actually when you get to the stage when it's really, really bad, sleeping on the opposite side
I was going to ask that.
can still cause pain because then the shoulder, gravity will pull it down. That's when it's really bad though. That's when it's really bad. So they ask you about that. See, the patients will come in, and when the patients come in, what we do, we go through a series of examination. Are they?
Rehabilitation Institute of the Caribbean.
Yes. So guys, we treat a lot of shoulder issues. So there's some special provocative tests that we do, right? And so we have a special test called the NAIR, right? And Hawkins. And these are some special tests that helps us to diagnose what exactly the problem is, to rule out other things.
Can you see arthritis as a
through
doctor?
the skin?
Yeah.
Interestingly, for example, when people have, and we're going to talk about arthritis of the hands, you ever see older folks with thick knuckles?
Yes.
Right, so you can have arthritis. You can see those disfiguring of the joints. So some people, when they have bad knee arthritis, you can actually see disfiguring in the knee. But of course, you have to make sure that's what it is, right? So you want to do an X-ray or
an MRI?
Right, but
no, MRI not gonna work.
MRI not so early.
Okay.
MRI is not so early. So X-ray, right?
Over.
Yeah, man. So you do an X-ray. So the X-ray will show you the bony structures, right? And so it can show you the alignment, if the thigh bone, or if you're talking about the knee or the shoulder. As we're talking about the shoulder, it can tell you about the shoulder alignment. Now, for example, someone who may have had recurrent shoulder dislocation. So some people, them shoulders slip out, people who have double joint, or people who would have had injury to the shoulder before. I mean, I have had someone, I don't want to say the job, let's give it away. They were driving in a truck, this will give you away, where you have to hold on, or people holding on in a bus. You remember first time?
Oh, yes.
And your hand is over your head,
Don't miss those
holding
days.
on to the pole, and it hit a pothole, and the shoulder jump out. And so you get dislocation of the shoulder. And so a recurrent dislocation of the shoulder can lead to shoulder arthritis.
Oh, my
Right? And so these are some of the things that, you do the X-ray, you see the arthritis. What do you see on X-ray? The shoulder joint the bone is closer to each other. So you have the glenohumeral joint, which is the round part, and the humerus. So you tend to have a little bit of gap between the two of them, so you can have nice articulation.
This is the normal.
This is the normal. So after a
Okay.
while, they
get
become closer, right? And then the AC joint, you start seeing bone spurs. You literally can, for AC joint arthritis, you can actually see thickening at the AC joint. So you can see like because the skin above where your clavicle is so
good.
thin.
It's good stuff.
You can see that. Now, if we, for example, remember, not every pain in the shoulder is shoulder arthritis. And so clinically we'll determine, is it muscular, is it soft tissue, bone, and then you may need to do another test like an MRI, which we'll of course do at Winchester, to determine if it's a soft tissue, for example, one of the rotator cuff muscles, which you're going to talk about at the next episode. I can't wait to talk
That's just like it's not today, but all right.
Right. And so once you make that diagnosis, then there's treatment, and the treatment has what we call an
Algorithm.
I always love an
I'm
algorithm.
just, I got this. Take us through the algorithm quickly.
Right.
Yeah.
Right. And so for me, I mean, once you stick to the algorithm, you always give the patient the best treatment. You always start with the least before you jump to the worst.
All right.
Right.
So you start with rehab?
You start with rehab. Excellent. And so rehab will have 3 parts. You will have physical therapy, which you come to one of the specialists one of the physical therapists at Rehab Institute of the Caribbean, and they'll evaluate you, and then they'll decide what it is. Now, there's another thing that we're going to talk about when we talk about rotator cuff is scapular dyskinesia, where the shoulder blade is not in the right position. And when it's not in the right position, it changes the biomechanics of the shoulder, and then you can get all sorts of biomechanical infringement, right? Yeah. And so then after that, now we'll give you the exercise, physical therapy, you get your home exercise program. You must do a home exercise program.
Yes.
But then with those 2 things, we have to look at your lifestyle, because if what you're doing is continually causing pain and problem, that what we're doing will be undone. So we have to look at your lifestyle. So if it's someone who sleeps on that side, if they're always reaching back in the car, different. If it's an occupation, you may want to do a little, modification of operation. For example, if you're a painter and you paint overhead, instead of standing on the ground and painting, get a ladder. So you bring this level that we are painting closer, right? So you're not reaching over your head. So you allow the area to heal. Then after that, we do medication. We always start with basic stuff. We start with painkillers like analgesic, acetaminophen, which, regular over-the-counter, cetamol, Panadol, Tylenol, those are the ones that we use. And then when that doesn't work, we step up to the NSAID, non-steroidal anti-inflammatory, like the diclofenac.
The strong one there.
Yeah, man, the ibuprofen. And then, all right, and so then after medication, there's injection, which is where I come in, right? And so we can actually inject into the joint. We can do it under X-ray guidance, we call it fluoroscopy or ultrasound guidance. And then we inject with several things. It might be with steroid. It might be with platelet-rich plasma, PRP. You remember PRP?
I definitely remember PRP. It's some science thing. It's amazing what
Right,
the
right.
body. You can't.
So PRP is where you are, where you take your own blood, spin it in a centrifuge, take out the platelets, and inject it back, right? And then, after that, there are some patients that definitely need shoulder surgery, right? And did you know that you can do shoulder replacement just like you have knee replacement?
Never just weird. How you replace your shoulder?
So it's amazing. So you get it's really a metal shoulder. So literally, it's not bionic though. So there's no electronics.
So you can't donate a shoulder that don't work. Got it.
No. So it's just like in the knee, the glenohumeral joint, which is the socket, and the humerus. When those are worn down, you can actually remove them and put in like a cap. There's orthopedic surgeons, of course. Jamaican have some of the most, I was about to say wickedest, but them the wicked is just awesome in terms of what they're able to do for the shoulder. And so surgery will be the last resort.
Okay.
So shoulder arthritis, essentially, these are some of the main things that you do.
I have one quick question.
Yes, ma'am.
My father got an injection because of arthritis.
Yes.
And
in the shoulder?
No, in his knee.
Okay.
And because of that, now he's walking with a stick. Because I think they said the injection, he had a bad reaction to the injection, or them give him a bad injection. So I don't know. So
how long was that? Long?
Long. Long. Like a month.
Month is a long time?
Of course, that long.
I think you're talking about 5 years.
No, man, that's a short time.
No, man.
Couple months, maybe?
No. So, no. I don't understand. I inject people in the knee all the time.
Okay, yeah. So somebody never do something right.
Not necessarily.
So people can have allergic reactions to the injections is what I'm asking.
You can usually are. So what for example, use steroid injection. We use lidocaine and we use which is steroid. Lidocaine is like where you get to the dentist and call cocaine, which is not really cocaine. Most people are not allergic to that. And then steroid is what you use to treat allergic reaction. Okay. So it depends. Sometimes they may be injected with Synvisc or some other supplementation. But let me take a look at your dad for you.
Okay, great. But that's all we have the time for. Thank you for joining us. Thank you to Power 106 Rehabilitation Institute of the Caribbean, all of our studio engineers. Thank you so much for joining us. Rehab Now is brought to you by the Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Denk, and Almighty Studios. We will see you next week, same time, same place. Bye-bye.
Blessings. Take care.